Hello everybody, my name is Mamdouh Abdelrhman, Professor of Pediatrics, Faculty of Medicine, Ain Shams University of Egypt. I am happy to be with you for the second time in the Australian Apitherapy Association. My topic today is entitled Topical Honey for Eye Diseases. This slide shows the list of eye diseases in which topical honey was used as a sole treatment. This includes corneal ulcer, conjunctivitis, diabetic retinopathy, dry eyes, chalazion, and mild traumatic lesions of the eye like corneal abrasions. For topical honey treatment, we usually use ziziphus or cedro honey, and the honey was raw and unprocessed, and it should not be crystallized. The first eye disorder to be discussed now is corneal ulcer. On June 3, 2004, presented to my clinic a 25 years old male who had suffered from a deep corneal ulcer for 7 months. The patient had consulted several ophthalmologists and he had received several forms of treatment including antibiotics, antiviral agents, steroids, but all without any improvement. There was no history of trauma to the eye. As we see in this photo, the left eyelids were swollen and the patient had marked photophobia. Examination of the left eye, as we see in this photo, showed a deep corneal ulcer with marked ciliary injection and marked conjunctival edema. This photo clearly shows the changes which occurred in the left eye affected. It shows the deep corneal ulcer, the ciliary injection, the conjunctival injection, and also appears here the drops of honey applied inside the eye. At first, the patient was hesitant to use honey for treatment, as was his primary care physician, who prescribed 2 more weeks of standard treatment, but these two failed to produce any improvements. Eventually, the patient's fear of losing the sight in his eye because of the possibility of endophthalmitis led him to agree to be treated with topical honey. This video demonstrates topical application of honey inside the affected eye. Honey was applied in a dose sufficient to fill the conjunctival sac. This dose was 0.5 to 1 ml per application. Honey was the only treatment used for treatment of this case. No other treatments were used. As we said before, we used raw, undiluted, unprocessed ziziphus cedro honey for topical application. A suitable dose of honey was topically applied to fill the conjunctival sac, usually 0.5 to 1 ml honey per application. Honey was applied at least twice daily, and the patient was advised not to wash the eye after honey application and to keep the eye covered throughout the day. The after effects or reactions of honey application in the corneal ulcer were generally in the form of a temporary increase of symptoms and signs of the underlying disease followed by improvement. The most annoying is the occurrence of moderate to severe burning pain immediately after application. This pain persisted for 1 to 3 minutes, followed by improvement. Also, there was an increase in the conjunctival injection and discharge, which were also transient. After 2 weeks of starting treatment on June 18, 2004, the ulcer healed, but it left a corneal opacity, and as we see in this slide, the conjunctival injection is clear, as well as the ciliary injection and also the corneal opacity. Also, new vessels appear, new vascularization. 7 weeks after treatment, on June 25, the size of the corneal opacity decreased, as well as the conjunctival injection and ciliary injection. Almost 3.5 months after starting treatment on September 15, there was a further decrease in the size of the corneal opacity. After almost 5 months, on October 27, as we see in this slide, the eye returned back nearly to normal. This slide compares the picture of the left eye before starting topical honey on June 2004 until end of treatment on October. That's after almost 5 months. As you see, the eye returned nearly back to normal, only left very small corneal opacity, and the patient did not continue topical honey. He was reluctant to do that because of the burning pain, which was sometimes severe following each honey application. Topical honey for other eye diseases other than corneal ulcer. Conjunctivitis, both infectious and non-infectious or allergic. In nearly all cases of conjunctivitis, whether infectious or non-infectious, topical honey resulted in initial temporary increase in the symptoms and signs of conjunctivitis, including more eye pain, redness, itching, and tearing immediately after application. The pain and itching spontaneously disappear after a few seconds, but the redness and tearing may persist for a few minutes to a few hours, depending on the severity of the case. Complete recovery occurred after 1 to several days, depending on severity of the case. Honey was applied in a dose of 0.1 to 0.2 ml per each eye, 2 to 4 times daily. Until today, 6 cases with type 2 diabetes mellitus suffering from diabetic retinopathy were treated with topical honey as a sole treatment for the eyes. 3 cases had the non-proliferative type with macular edema, and the other 3 cases had advanced proliferative type with retinal hemorrhage, and these illnesses did not respond to laser therapy and Avastin injections. All cases were treated by topical honey in a dose of 0.2 ml honey for each eye, 2 to 4 times daily. 4 patients continued the treatment for more than 1 year, whereas 2 patients continued the treatment for almost 3 months. The bleeding inside the eyes stopped in the 3 cases who had proliferative retinopathy, and the edema significantly decreased in the other 3 cases. During the course of honey therapy, all patients stopped all forms of traditional therapies, including laser and injection therapies. 5 patients stopped topical honey after improvement because of the burning pain which follows each dose of honey, while only one patient who had non-proliferative diabetic retinopathy is still using honey for more than 2 years, but in a much less frequent doses, 2 times weekly, and when her vision is blurred. We successfully treated 3 adult patients suffering from dry eyes with topical honey as a sole treatment. Significant improvement occurred after 2 weeks to 3 months of honey application, with a dose of 0.2 ml per eye 3 times daily. Also, we successfully treated 2 cases with chalazion using topical honey as a sole treatment without need for surgical removal or other topical therapies. Topical honey application in a dose of 0.2 ml per eye twice daily resulted in disappearance of the lumps or cysts after about 1 month in 2 male patients, 1 adult and 1 child. However, the swellings recurred in the child a few months after stoppage of topical honey, but with continued application, the swelling did not recur for almost now 9 years. Thank you for your attention.